I'm here with my patient. She was brought to the ER because she had weakness, fatigue, anorexia, and she had been vomiting a lot. While she was in the ER, she was diagnosed with adrenocortical insufficiency. So I'm going to be teaching her about that today, some of the medications she'll need, the side effects of those, interactions that the medications can have, and other important preventatives that she can learn about today. Also, when she came into the hospital, she had hyponatremia and hyperkalemia, which can cause a lot of issues as well, and so I'm going to teach her about that today, too. Hi, I'm your nurse, Maddie. I'm going to teach you today about your diagnosis and some of the medications that you'll need here on out. So some of the medications that you'll have to take is first, you will need a glucocorticoid. That is what your adrenal glands make. Naturally, they make a steroid, and that's what you're lacking, and that caused your condition. And I don't want this to happen to you again. So you'll take the glucocorticoid. You need to take 2/3 in the morning and then 1/3 in late afternoon. That's to help with GI upset because you don't want to take it all at once. And it's also following the natural circadian rhythms of your body. So you want to take it when those would be naturally released. Another thing that you'll need to take is a mineral corticoid. Kind of sounds the same, but it's another steroid that your body produces, and you will just take this in the morning. The name of this is fludrocortisone, so you might have that prescribed by your doctor. You want to increase your salt if you're going to be in a humid environment when it's hot, because your body will be putting off more salt and sweat, so you'll have to increase your salt intake because your adrenal glands aren't able to keep up with that anymore. Anytime you're having any increased stress, so if you're having an infection, if it's just a stressful time of your life, any things like that, you will need to increase your dose of these steroids. Your doctor will help you to know when to increase those doses. And if you're vomiting or you have diarrhea, you'll need to increase your dose as well because it's not staying down, so you don't want it to keep coming up. If that does happen, you might need to come into the hospital to get the steroids through an IV to make sure that you don't have this crisis happen again.
So when my symptoms are done, I can just stop taking the steroid?
Sadly, you will have to take it for the rest of your life now because once you start taking it, it will suppress the rest of the normal function of your adrenal glands. But without them, you will have this crisis again where you feel really sick and terrible. So you'll have to keep taking them.
Okay.
Yes. And so some of the side effects are really important to know about these medications that you'll be taking. They can cause skeletal muscle atrophy. You could get diabetes from them. It can cause fat redistribution. So sometimes it'll gather around the belly area or the back of the neck. These are things you want to be watching for to let your healthcare provider know. You also have delayed wound healing. So if you get a cut and you just notice it's taking a little longer to heal, that could be an effect of your medication. And it gives you an increased risk of infections, swelling, edema. That's another word for swelling. It could increase your blood pressure and cause osteoporosis, so a breakdown of your bones. So I'll teach you some other preventative ways to help prevent those.
Okay. They sound kind of awful, the side effects. So if I start feeling a side effect, can I just stop taking the steroid?
That's also not a great idea either. You want to keep taking them. If you have the side effects, like I said, let your healthcare provider know and he can taper the dose. But if you stop taking them, that'll cause the crisis that brought you into the hospital today. Because without them, your body can't manage stress. It just doesn't work like it usually does. So it's important to not stop taking them abruptly, but we can taper the dose to control the side effects. The ones I listed, the side effects can cause what we call Cushing's syndrome. That's where you have, so we're replacing these steroids, these hormones you're missing, and by doing that, it can cause them to go too high. So that's what causes the different side effects that I was talking about. So definitely watch for those and let us know if you have any issues. Another thing, when you're taking these, you will need to increase them if you're taking any medications like phenytoin or barbiturates, also rifampin for HIV, or if you're taking antacids.
Okay.
This will be in the, I'll include all this information in a folder for you to take home.
Okay, great.
And also, if you're taking any estrogen pills, you will need to decrease the doses of this adrenal medications.
Okay.
Yeah. But most importantly, I can teach you about some of the ways to prevent this from happening again. You can buy a medic alert bracelet. That would be really good to wear. So if you ever become unconscious from not taking your medication, like if you have a crisis like this again, medics will be able to know how to treat you quickly and not be wondering what's wrong with you. So they have actually some really cute ones on Amazon that you can buy.
Good.
You can always carry a medication emergency kit with you, so always have an extra dosage of your medication with you in case there's like increased stress and things like that. And you want to teach your family how to give you an intramuscular injection in case you're not keeping it down orally. You need to get it really quickly. So you want to know how to do that and teach your family how to do that.
Okay.
And I can show you today as well if you're unsure about that.
That'd be great.
So we want to prevent falls and infection. Because your bones might become brittle from this medication, you want to make sure that you're eliminating hazards in your house and being careful when you're walking. You can do low impact exercise. It's really good to stay active that way though. Taking vitamin D and calcium supplements will really help your bones as well. And if don't be around someone that is sick. Try to decrease your infection rate as best possible because your body won't be able to handle it as well and you'll have to take more of your steroids. We're going to teach you to take your blood pressure often because the medications can raise your blood pressure, so you want to keep a check on that. Another drug that we could give you to help with your bone density and osteoporosis is called a bisphosphonate. I'll include that in the teaching materials and you can talk to your doctor about that. He might prescribe that for you. You'll want to see an eye specialist yearly because these drugs can cause cataracts or glaucoma, so making sure that you're doing that is a really good idea. For your diet, you want to have high protein, high calcium, and high potassium. So protein, calcium, and potassium. And you want to decrease fats. That'll help just with your overall health too and for your bones and get good sleep. That's when your immune system ramps up and it's really good for, like I said, overall health too. It'll help the conditions that the medications can cause. And if you're ever having symptoms where you feel really thirsty or you feel like you're peeing a lot, or if your vision gets blurry at all, you definitely want to call your doctor because this can be symptoms of diabetes, which can be caused by the steroids you'll be taking. So you'll come in and have your blood sugar checked, and that's something they'll do at your yearly doctor's appointments as well.
Okay.
So all of those things should help you prevent the complications from your medications and prevent any other things from happening. Do you have any other questions?
I don't think so.
Okay.
Thank you for explaining everything.
You're welcome. And here's some of the teaching materials for you so you can look through them. I highlighted some of the important points. And
Great.
yes.
Thank you.
You're welcome. Have a great day.
Thank you.